You're listening to The Voice of Russia in London with me, Juliet Spare. Are some women too posh to push, or are they simply too scared to give birth in a so-called normal way? The latest maternity figures from the Health and Social Care Information Centre reveal that last year 25% of mothers in England had a caesarean. In the last 2 years, 1 in 10 mothers aged 25 to 34 had an elected caesarean purely through choice. Today, 1 in 4 babies is born by C-section, which has raised concern from the Royal College of Midwives. So does pushing for a so-called normal birth always give the best psychological outcomes for mothers and babies? I'm joined by Pauline Hull, co-author of Choosing Caesarean, a Natural Birth Plan, Toni Harman, co-founder of One World Birth, Virginia Howes, an independent midwife in Kent, and Zara Chamberlain, an NHS midwife counsellor, and Maureen Treadwell, co-founder of the Birth Trauma Association. So, Pauline, why, in your opinion, do you think more women are choosing to have a caesarean?
Very often what I come across is women who are petrified of vaginal birth, but actually not very scared of a planned caesarean. Not that they're taking it lightly, but they don't have the same level of fear. So some of them don't actually want to go through counselling or have perhaps a mental health issue on their records. They feel that they've looked at the risks and benefits. They just want to have a very open and supportive discussion about the 2 different birth plans and then go with the planned caesarean. Some people see birth as inherently safe and some people see birth as inherently risky. And I think if you're someone that does see it as inherently risky, and we've just, as you say, we've had the new statistics out today, and we know that 15% of women end up having an emergency caesarean, 13% of women end up having ventouse or forceps, so an instrumental delivery, and they are very big factors in the fear that women have that they may not have a natural, spontaneous, idealised birth experience. And while I think it's important that women who want to have that experience, that they should be fully supported by midwives, equally for women who just don't want to have that experience, don't perceive it as having any more benefits than a planned caesarean. For example, when they're weighing up the risks and benefits of the 2 birth plans, they see more benefits in the planned surgery than they do in the natural birth. It's just that those women should be allowed to have that choice, and it should be supported in maternity wards across the UK.
Maureen Treadwell, then I'll come to you then. You're working for the Birth Trauma Association. You were agreeing then with Pauline, what Pauline had to say about the tocophobia and the not irrational fear of giving birth.
Yeah, I mean, we see lots of women who've suffered quite severe injuries as a result of childbirth. And I think we have to get away from saying that a spontaneous vaginal birth is always going to be best, because it's very much what the woman wants and how she perceives birth and what risks are important to her. I mean, if your worst imaginable risk is going into hospital and having things done to you, you'd be much better off, with a home birth and planning to give birth completely spontaneously at home. But if your worst imaginable risk is having a really traumatic birth ending with perhaps perineal trauma, then maybe an elective caesarean is right for you. So I think I'd like to get away from sort of women being prescribed what is right for them, and then understanding that women are different and they make different choices and we should respect them.
I think that's what it is. You come to the women's choice, and actually that they are allowed to choose which path they go. And that's along your lines with, you wrote the book, Choosing Caesarean, a Natural Birth Plan, and that women should be allowed that human right to have that choice, which I know coincides with your film, Toni. But before I come to you, I will now ask Virginia, because you look like you were about to disagree quite vehemently.
It's not that I disagree. I want to ask a question. And Pauline mentions, obviously, the fear of childbirth. And then we came on to the trauma caused by childbirth. But I want to address those 2 things and ask the question, why are women so afraid of childbirth? And why are they suffering so much trauma in childbirth? And I believe, and there's a lot to back this up as well, that fear underpins childbirth, not just from women, but from the professionals that look after them. And until we get to a state where birth is seen as a normal life event, not only by women, but by the professionals involved, then women are going to be the losers.
Zara, I'm going to come to you then, working in as a midwife counsellor currently in the NHS hospitals. Would you be able to answer that question as to why women are so scared of childbirth?
I work at Ashford and St Peter's Hospital in Surrey, and every woman is an individual. They all come from different experiences. They may have delivered before and had a previous difficult delivery, traumatic delivery. It may be their first, and they're very traumatised for whatever reason. It may be tocophobia, it might be something else. And I think the most important thing is to listen to each woman. When a woman requests an elective caesarean section, we have to find out, and I agree with the previous talker, as to why they are so fearful. And in my experience, once you actually counsel the women and you listen to her and find out what her fears are, very often women are requesting an elective caesarean section, but they don't realise that actually a caesarean section is major abdominal surgery. It also comes with its own risks. And sometimes women are not aware of this. They just think that it's going to be a straightforward caesarean section and everything will be fine at the end of it. So in my experience, those women who come along requesting an elective caesarean section, it may be because of tocophobia, in which case we will support her. And for some women with tocophobia, the only way to deliver would be a planned elective caesarean section, which also can be very frightening and scary. But we would support her. We work as a multidisciplinary team. Everybody has their own job to do. That's the consultant obstetrician, that's myself, that's the community midwives in the hospital. We work together as a team to support that woman in the way that she wants to deliver. And we have to remember that the majority of babies are born naturally. A lot of midwifery units now do actually have a birth centre. So natural birth is encouraged. We are trying to provide women with a choice, and that may be from the very, very natural, low-risk delivery, those women that want a normal, natural delivery, to those women who may need more intervention.
I'm going to come to you now, Toni, because you are a co-founder of One World Birth, and so you kind of agree with Virginia in many, many, many ways.
So we made the feature-length documentary called Freedom for Birth, where we look at the human rights in childbirth for women in developed countries around the world. So we filmed in the Netherlands, Hungary, in America, UK, Canada, and we interviewed over 100 experts, including Pauline, but she's not in the film, and that's midwives, obstetricians, perinatologists, academics, researchers, doulas, and most importantly, human rights lawyers. And it's looking at the rights of women and whether those rights are fully respected by care providers. So in an ideal world, yes, all women should have the full choice to decide, the full informed choice to decide how and where she gives birth. So I respect a woman's right to choose an elective caesarean. I also respect a woman's right to choose a normal vaginal birth. The problem is that the way the obstetric system in developed countries tends not to respect the women's rights. It tends to be that a care provider, and that could be a midwife or an obstetrician, thinks it's their role to tell a woman what to do when she's giving birth. And if a woman goes against that advice or doesn't do what she's told, or at least questions what she's being told, then that care provider, so whether that's a midwife or an obstetrician, will do whatever they can to force the woman to make decisions. So we've filmed women who had forced caesareans. So a woman in the Netherlands who was expecting twins, and she was forced to have a caesarean against her wishes. So that's one extreme. There's midwives around the world who are being imprisoned for supporting home births. So a woman like Agnes Gareb in Hungary. But at the other end of the spectrum, it's about women not being given true informed choice.
You're listening to The Voice of Russia in London with me, Juliet Spare. Joining me to discuss the increase in caesarean births in Britain is Pauline Hull, co-author of Choosing Caesarean, a Natural Birth Plan; Maureen Treadwell, co-founder of the Birth Trauma Association; Toni Harman, co-founder of One World Birth; Virginia Howes, independent midwife in Kent; and Zara Chamberlain, an NHS midwife counsellor.
I think one thing we're forgetting here is that, if a woman requests an elective caesarean section, for instance, she will be counselled. She will be given the pros and the cons of an elective caesarean section versus a natural delivery. She will be counselled that actually things can go wrong with major abdominal surgery. And the mother then has to make a decision, an informed decision. Is she going to take the risk of signing that consent form after given all the pros and cons? That's up to a woman. That's a woman's right. But I do think women do have the right to choose, as long as it's an informed decision. And most women, once they understand that actually a caesarean section can go wrong, and things do go wrong with caesarean sections, then they think again and they say, right, well, okay, it's like balancing the scales. Let me weigh up the pros and cons. I didn't realise this. And in my experience, the women that I see who request an elective caesarean section, in the majority of cases, with good support, with a robust birth plan, with a tour of the obstetric theatres, of the labour ward, of a supportive tour, meeting people, feel held, they feel supported, and we provide holistic care for those women, and the majority of women will go forward and have a normal vaginal delivery.
Overall in the UK, there is a push towards what's described as normal birth, which is to have a birth without an epidural, without a caesarean, basically with as few medical interventions as possible. And my concern is that that's actually what's being forced on most women. I think in some ways the doctor that Toni had in the UK, it certainly isn't in the majority. In a lot of cases, the woman would be advised to try and turn the baby rather than just go for a caesarean. But breech is a small percentage of women that are breech. If we're talking about back to the sort of tocophobic women who might be fearful, one of the first things women do nowadays is get on the internet. They go and see what happens. We used to, I think there's a reason people are fearful of birth, and that's because historically women have died, babies have died. Women and babies have been injured. That's a fact. What's happened with medical intervention is it's helped reduce some of those injuries and certainly reduce large numbers of those deaths. Mm-hmm. That doesn't make caesareans safe categorically. However, for a long time we talked about caesareans as if they were one thing. There are planned caesareans and there are emergency caesareans. Planned caesareans then can be broken down into caesareans prior to the onset of labour, caesareans for medical or obstetrical reasons, and then maternal request with no indication at all. And my concern is when women go into their antenatal classes, whether they're the NCT or NHS, and when they're speaking to midwives, it's a bit luck of the draw. Some people are. I think the risks of a caesarean are overestimated, and actually I've heard midwives and obstetricians talk about risks that are actually associated with emergency C-sections, not planned C-sections, yet they use those to describe this is what you should be fearful of, this is the thing you should be afraid of, the major surgery. So we're not seeing subjective information going to women from the professionals that are caring for them. It's very much a postcode lottery. Also, in terms of the support, I admire midwives that are supporting women who may be tocophobic, and I think it's great that they offer the support. I just think the word offer is very important, because I've had women contact me and I've had absolutely horrendous experiences with their midwives who have tried to coerce them into having a normal birth. I've had 2 women who have terminated their pregnancies because even after going through cognitive therapy, one of them was still told, you cannot have your caesarean. That's what's happening in maternity wards here today. And I've said this for a long time. I think the campaigners for choice on the home birth side are, I'm trying to think of a better phrase than shooting themselves in the foot in the long run, in the sense that the safety data is looked at, and we know that planned caesareans do have very good outcomes, both in terms of health and psychological outcomes for the mother. We know that more women that have a planned caesarean on maternal request are satisfied with the birth at the end compared to women who plan a natural birth and perhaps don't get what they want in the end. And I just think it's a shame that we can't, as professionals and as campaigners, all come together and have choice across the spectrum. That's not what's happening online. It's not what happens when you look on the forums. And, and unfortunately, as I said, I was disappointed that it didn't happen in your film.
Well, I suppose I'd have to come to Toni just to respond to that, because I must admit, when you say choice, for me, that's for anything, not just a natural birth or a normal birth, a so-called normal birth, or a home birth. Why did you then omit using anything on an elected caesarean?
It wasn't a case of omission, because the film deals with choice for whether you choose a hospital birth or a home birth, whatever. So it's talking about choice across the whole spectrum, that legally women have the right to choose. I think, and I would respect a woman's right to have a caesarean. The loudest voice and the most underrepresented voice across the developed world are women who want to have a normal physiological birth and are denied access to this. We filmed in hospitals in America, and as soon as you walk through the door of a delivery suite in America, you get an IV drip into your arm without, you don't even get asked if you want that, you get an IV drip. And you're started on, your waters are broken, you started on synthetic oxytocin. It's already, you'll undergo a series of interventions. So those women who want normal physiological birth can't have it. And I think that's the voices we're representing, are those voices where they just want to have a normal birth. And I think because the culture within our developed world, as if you want a caesarean, I'm not saying all women, because there are those examples.
Not in this country. In this country, it's, you see, this is one of the problems. Obviously, you've looked at the whole of the developed world and looked at different countries, and you're right, the setup in the US is very different to the setup in the UK. I had both of my children by planned caesareans in the US. However, I was pregnant within a month of moving there, but I had inquired as a woman who was going to become pregnant in the UK, could I have my planned caesarean, and was told absolutely by 2 doctors and two local hospitals, no way. So I had a very different experience. So what I'm saying is 2 wrongs don't make a right. We need to provide choice everywhere.
You're listening to The Voice of Russia in London with me, Juliet Spare, and joining me to discuss the increase in C-section births in Britain is Pauline Hull, co-author of Choosing Caesarean, a Natural Birth Plan, Virginia Howes, an independent midwife in Kent, Toni Harman, co-founder of One World Birth, Zara Chamberlain, an NHS midwife, and Maureen Treadwell, co-founder of the Birth Trauma Association.
I think we have to say that there's problems at both ends of the spectrum, and I think if we're going to argue for choice, we have to argue for choice across the spectrum. Now, we deal with women who've had really traumatic births. A lot of those births are to do with ending up with really serious problems like perineal trauma, incontinence, prolapse, and in the occasional case, colostomy. And women sometimes say, I was told all the risks of caesarean section. Nobody told me anything about what could happen if I had a vaginal birth. Now, I do think we have to address that. But I take on board your point. I completely agree. If a woman wants a vaginal birth, if she wants a normal birth, she should have the absolute right to that, and we should respect it. But we do have to argue for this broader spectrum.
We need this move away from everybody goes to hospital, everybody gets on the bed, everybody gets monitored, everybody has this. And the shift is, for some women, elective caesarean section. There is a middle ground. There's a middle ground. And I agree with the midwife on the phone that women are individuals, and every woman should be looked after on an individual basis. And yet in this country and many other countries, it's one size fits all. You go into hospital, this is what we do here, and this is what you're expected to do. This is the information we're going to give you, because selective information, we're going to tell you this is the risk of this and this is the risk of that. But there are risks of other things that get left out. And so women are just at the mercy of the culture and the fear of childbirth and the information that the provider is given to them. When I look after a woman, I look after her as an individual. And if she makes one choice or another choice, I'll support her on that choice. And we'll look at every single aspect of that choice.
But you're an independent midwife, so she has to pay for that choice.
She does have to pay for that choice. Yes, she does. And she chooses to pay for that choice. And I will just nip that in the bud as well, because I do not look after rich women, and nor do independent midwives. We look after women who budget for what they want and for what's important to them.
I think that does happen, though. We say to a woman, if you have an epidural, then mobility is going to be reduced. You know, in our hospital where I work at St. Peter's, all the beds are moved to the edge of the room, so the woman is not encouraged to come on in and just get on the bed. We have Swiss balls, we have mats, we have Entonox that can be moved around with her. We have baths that she can use for pain relief. If a woman decides that she wants to have an epidural, that is discussed. Mobility is going to be reduced. You're not going to be in an upright position, and therefore descent may not happen as it would do if you were more mobile. But a woman doesn't know what she wants until she gets into labour.
Well, she should be informed before she gets into labour about lots of things. And women, the only information the majority of women have in this country about birth, I know that they can go on the internet and they can research it, but most of them don't, because they trust in the professional. But the most information that women in this country get about birth is watching horrific birth programmes on the television that portray the obstetric model of care and the odd, quick, normal birth rushed in. So they see birth as being this huge traumatic event that the professional is going to save them from and save their baby from. And in my experience, 400 home births in my career, that is not how I see birth. And women do not see birth in that way. And if they were exposed to birth in that normal, natural way, years ago they used to listen to birth in the street with their mothers giving birth, the normal screams of a woman in labour. They weren't afraid of it because it was a normal part of life. It is no longer a normal part of life. It's hidden. It's hidden in hospitals.
Pauline, do you feel that there hasn't been the choice, and that the normal screams of women giving birth should be, something that culturally women adopt across the world, and that
I think they hear that they may not hear them literally, but they go on places like Mumsnet. They talk to each other. When I mentioned the internet, I didn't mean just for research. You used to know how your mother gave birth, maybe your aunt, maybe your sister, but in general now we have thousands of people's birth. There are so many birth websites. You can read many birth stories, and so many of them have experiences that aren't very nice. You can understand why a woman would be fearful. But if I could just say, I also think there's a fear from the professionals as well, that the caesarean rate might rise. And I think there is such an obsession with keeping the caesarean rate down and targets, that we try and have the woman trial of labour first, caesarean last resort. And I don't think that's the way to go. And I think you mentioned that there was a mention there before that we don't talk about stillbirth risk. I work with a charity that is involved in this, and there are many women who get to 40 or even 41 weeks gestation. They're not told about the increased risk in stillbirth, and we can talk about natural and normal birth all we like, but the fact is women are getting heavier, women are giving birth at older ages than ever before, and babies are getting bigger. That is an obstetric challenge, whether we like it or not, and how we handle that, I think we could just do it better going forward on all ends of the spectrum.
But the fear factor you mentioned in the programmes that are on the television, and you've got the fear factor compounded by stories on the internet, and women or mothers-to-be are exposed to all of that. There's no right or wrong answer whether you choose to have a caesarean or you choose to have a so-called normal birth.
It is really right across the spectrum. Women have different attitudes. They have different feelings about birth. To some it's very important. To some all they care about is having the baby, So I think we have to accept women are different. They will choose different stories, different modes of care. The most important thing is that we listen to what they want and we make sure they get really accurate information. And those, I think particularly the information is the challenge at the moment, because we're not agreed on what is good information.
OK, final word from you, Toni.
I think Maureen's right. I think it's all about listening to women. I think women need to find a voice and to speak out about what they want, and to claim the right to choose the circumstances of their birth, to decide where and how they give birth, and for every single care provider to support every woman in their birth choice, and to make provision within that birth choice. I mean, sort of within the Europe, that's a protection as protected by the European Court of Human Rights. But around the world, this needs to happen.
Zara, I'd like a final word from you.
I think it is really important to not only listen to the women, but to actually hear what they're saying. And in all I can say is that from my experience, a lot of women who are requesting an elective caesarean section, if you actually listen and hear what they're saying, it's because perhaps there's been a past history of sexual abuse or some childhood trauma that makes them very fearful, and what they're asking for isn't necessarily an elective caesarean section, but just support me through a normal delivery.
Most women, and the elective caesarean section is a very small minority group. Majority of caesarean sections, as Pauline knows, are emergency caesarean sections, brought on in the most part by interference in normality. Most of the time, a woman who elects a caesarean section is electing it through fear of what happened to her the first time or some other underlying fear, and it's the fear we need to address. Where childbirth is concerned, there's nothing to fear except fear itself.
But that is a slight contradiction to Pauline, who says that, with an increase of elective caesareans, you will have a decrease in emergency caesareans.
I don't think there's any evidence of that. There is no evidence that if more women choose an elective caesarean section,
No, I didn't
Pauline,
say if more women
that
chose. I said if it's possible to increase our planned caesarean rate in this country and decrease our emergency caesarean rate.
I don't think we've got any
possible.
evidence of that. That
we
will be
absolutely
beneficial.
do.
No, I don't think so.
But I will, Pauline, finally, though, from you.
Sorry, I was just going to say, just because there might be people listening, there's two things I wanted to say about cost. Obviously, the NHS is not a bottomless pit. Home births cost money, elective caesareans cost money. I would just like to say on the elective caesarean front that NICE did find that once you look at the downstream costs of adverse outcomes with women who have a trial of labour, for example, incontinence and prolapse, the difference in price reduces to £84, they found in that last guideline. So it's not an issue of cost. And the last point would be that this isn't about the too posh to push phrase brings up images of yummy mummies who just want to have a caesarean. In actual fact, very, very large percentages of doctors are having caesareans. That's medical professionals choosing to have a caesarean. So some of us are making a very informed choice, not through fear at all, but through thinking, I'd rather that set of risks to that set of risks. Thank you.
I'm a midwife and I have my 3 children at home underwater.
Good for you. Well done. I bet you gave the government an awful lot of money.
Well, I was very lucky because I was low risk, and I think that's one thing we haven't mentioned here is that, of course, those women having home births and delivering in birth centres are women who are low risk. There are women, of course, who are high risk through no fault of their own, and they need to be delivered in an obstetric setting.
But they still have a choice.
They do have a choice, absolutely. In most cases, obviously.
In all cases.
The woman that has a preterm labour or has severe preeclampsia, she'll have choices around the best possible safe delivery for her and her baby.
She'll have total choice, otherwise it's illegal. That's the bottom line. Every single woman has her own choice.
And most women will want...
Most women with good care will make the right choice.
I'm going to have to close it. Zara, go on. Zara, last word, Zara.
Most women will want what's safest for her and for her baby.
Right.
And that's the ultimate aim.